The concept of failure to rescue deteriorating patients has been studied and discussed worldwide, with many safety net programs implemented. New South Wales Health has implemented the Between the Flags program. The program uses track and trigger patient observation charts and a detect education package. The education package aims to develop and utilize skills of clinicians, providing tools to assist in identifying and managing the deteriorating hospital patient and to recognise when rescue systems need to be activated. As a patient safety officer, I've led many investigations into adverse patient outcomes and the failure to recognise when a patient's condition is deteriorating and then taking appropriate action in a timely manner, which has remained a consistent theme. In many cases, accurate assessment in the early stages of deterioration and prompt action would have resulted in reduced adverse events. I've become aware that auditing of New South Wales standard observation charts has identified delays in escalation of care when a patient's observations had fallen into one of the trigger zones. A significant discrepancy was found between the clinical reviews that should have occurred for patients in the trigger zone and the actual number of clinical reviews undertaken. These discrepancies have occurred despite significant investment in targeted education and the introduction of rescue programs over a period of time. My proposal is based on promoting strategies to enhance the knowledge base and skills of the ward nurse caring for deteriorating patients. We can ask the question, can using this A to G assessment tool enhance ward nurses' skills for accurate assessment and escalation to medical care for a clinically deteriorating patient? You are probably asking, how can another program work when others before it have not? I believe that utilizing physical assessment airway to glucose tool from the Detect Education program promotes consistency of learning. A comprehensive head-to-toe assessment by the nurse in charge will enable deteriorations in the vital signs to be aligned to adverse signs and symptoms identified during this physical assessment. Recognition of the severity of changes in the patient's condition should then lead to timely and appropriate clinical intervention. Any patient who is in the trigger zone of the observation chart should have an A to G assessment by the nurse in charge. My study design will be undertaken as a mixed method study with data collected using retrospective chart reviews, observational point prevalence audits, semi-structured focus group interviews, and pre- and post-education intervention questionnaires. I will aim to demonstrate that rescue systems for patient deterioration should not work in isolation, and that improved patient outcomes can only be achieved where the programs are able to enhance the skills of ward-based nurses and empower them to recognise when rescue systems need to be activated.